Safety and De-escalation training course. The safety and de-escalation training will teach the skills and competencies necessary to effectively prevent, minimize, and manage behavioral challenges with dignity, safety, and the possibility of change. After completing this training, you'll be able to understand how and why crisis events happen and ways in which we may inadvertently contribute to them. Intervene after a crisis to reduce the chance that it will happen again, and identify barriers and use de-escalation tactics that are non-physical skills used to prevent a potentially dangerous situation from escalating into a physical confrontation or injury. What you will not be taught in this training is how to break up fights or anything else that might get you hurt. Verbal de-escalation is a targeted preventative intervention method used when a potential or dangerous situation arises in an attempt to prevent a person from causing harm to others. Seclusion is a type of restraint involving confining a person in a room for which the person cannot exit freely. Restraints include the use of physical force, mechanical devices, or chemicals to immobilize a person. Physical force should only be used as a last resort to prevent injury to yourself or another person. Without specialized training, physical force in seclusion and restraints should never be considered or used. Clients have the right to be treated with dignity and respect, receive individualized treatment, and be protected from sexual abuse, economic abuse, or exploitation. Staff responsibilities to clients include, but are not limited to, treat with respect and dignity, follow procedures, increase knowledge, address behavioral emergencies, and provide emergency assistance. Your staff has the responsibility to keep control over angry feelings, and your staff should never use physical restraints or seclusion as an attempt to punish or avenge disruptive behaviors. When treatment is individualized, it helps therapists and clients. It provides opportunities for change and growth. Individualized treatment is a client's roadmap to recovery. Research has shown that persons served often views these types of interventions as painful and dehumanizing, and find that seclusion and restraints are not therapeutic. How do you know when you're being personally or physically threatened? The answer: trust your instincts. Do not ignore your feelings on a situation. Observe behaviors. Look at what the individual is doing and projecting. Evaluate how you feel. Whether you are new or seasoned in the use of de-escalation, how you react matters. As a healthcare professional, you could be faced with hostile or challenging behaviors in the workplace at any given time. While no training can substitute for experience and judgment, your knowledge of de-escalation tactics can be effective in improving your confidence in coping with an individual's aggression. Behavioral escalation is the cycle of which conflict or undesirable behavior worsens and becomes more intense, serious, and possibly dangerous. Diffusing or de-escalating behavior is utilizing research-based positive behavior supports and interventions to lessen and alleviate conflict with the goal of returning to the state of recovery. Barriers to communications are things that keep the recipient from understanding the meaning of what the sender is saying. Communication barriers can lead to misunderstandings, resentments, and feelings of demoralization, not just from the person served, but also for healthcare workers. Types of barriers include physical barriers, perceptual barriers, emotional barriers, cultural barriers, interpersonal barriers, language barriers, and gender barriers. Physical barriers can be closed office doors or separate areas for people of a different status. Invasion or encroachment of personal space tend to heighten anxiety. Challenging postures that tend to threaten another person's can escalate any situation. These can include face-to-face contact, nose-to-nose contact, finger pointing, eye-to-eye contact, and touching. Perceptual barriers is when one views the world differently than others. and emotional barriers comprise mainly of fear, mistrust, and suspicion. Research shows that one of the chief barriers to open communication is emotional barriers. A cultural barrier can be defined as different cultures having different meanings to different words, behaviors, and gestures. An example of a cultural barrier is when a provider lacks knowledge about a client's cultural background. This lack of knowledge can interfere with treatment and lead to potential conflict. Barriers to interpersonal communication can occur when a message is received differently than how it was intended. This misunderstanding and breakdown in communication can result in conflict. Research shows that a breakdown in communication, whether verbal or nonverbal, can result in aggression. This breakdown in communication can also result in repetitive routines devoid of real contact. The greatest compliment to another person is being able to communicate in their own language, yet in many cases this does not occur due to language and cultural barriers. When staff becomes familiar with another person's expression or language jargon, it can reduce conflict and increase comfort level between therapist and client. Gender barriers to communication can incite challenges in the workplace. Assumed gender roles and interpersonal differences can contribute to gender barriers. Distinct differences between the speech patterns of individuals can result in a communication breakdown. Specific barriers to communication include criticizing, ordering, threatening, name-calling, not listening, prejudging, engaging in power struggles, shouting, threatening body gestures, aggressive-looking facial expressions. Verbal de-escalation involves using calm language along with other communication techniques to diffuse or de-escalate a conflict situation. Open and clear communication is essential to de-escalating successfully. Use positive and helpful statements. This can help staff get on the road to effective verbal de-escalation. Work to put yourself on the side of the person served to help find a solution to problems. Understanding that behavior is a way for people to express feelings and get their needs met is key to understanding aggression. Emotions are feelings. A person's behavior can be destructive and dangerous, or it can be constructive. A person who is aggressive may be saying, "I feel threatened." Many people have learned to use inappropriate behavior to get their needs met. Staff are responsible for helping the person express emotions through appropriate behaviors in order to get their needs met. The stages of behavioral escalation: calm, trigger, agitation, acceleration, peak, de-escalation, recovery. Examples of effective de-escalation communication statements: "I'm sorry that you're upset. Can we talk about what's going on? Is that okay with you? I can get someone else to talk to you if you would like. Would you prefer that? I really want to find out what's bothering you so I can help. Do you mind if I ask a few questions about what happened?" Tactics to decrease agitation: align yourself with the person. Find a point of agreement. Cast yourself as an ally. Distance yourself from authority and acknowledge any point of truth. You should be attempting to empathize with the other person. Give them choices, set limits, change the subject, refocus the person on something positive, use humor to lighten the mood, and listen. Securing your personal safety: call for help. It is an important learned skill to be able to assist an agitated person to shift focus or direction of energy. An example: change topic of conversation to assist the speaker to get an out of rut when the topic of conversation is no longer productive. Staff de-escalation tips: breathe, act calm, relax muscles, reassure yourself with positive self-talk, focus on success, don't be afraid to ask for help, stay in safety zone, and use natural barriers. Physically attend to the person. Listen to what they are really saying. By restating, clarifying, and reflecting, attempt to validate their feelings. Feedback may help prevent someone who is beginning to escalate from further escalation or prevent future escalations. However, it is not useful if someone is already highly agitated. Intention is everything. It is essential that you tune into the intention of the person who began the conversation. For example, is the person really attacking you, or is the person attempting to get their point across? It is important to acknowledge and accept a person's emotions and feelings. Debriefing. Debriefing assists in the re-entry process back into the community and workplace. Debriefing can be done in large or small groups or one-on-one, depending on the situation. Debriefing is not a critique, but a systematic review of the events leading to, during, and after the crisis situation. After a critical incident, it is important to staff to speak to their thoughts, feelings, and concerns. Assess the impact of the critical incident on personnel and survivors. Identify immediate issues surrounding problems involving safety and security. Use diffusing to allow the ventilation of thoughts, emotions, and experiences associated with the event and provide validation of possible reactions. Predict events and reactions to come in the aftermath of events. Conduct a systematic review of the critical incident and its impact emotionally, cognitively, and physically on survivors. Look for behaviors or responses to crisis or trauma. Once the incident has been reviewed, bring closure to the incident. It is essential and will assist personnel in initiating and starting the process of rebuilding through community resources and workplace environments. Ventilation and validation are important to individuals in their own way. They allow for the discussion of exposures, sensory experiences, thoughts, and feelings that are tied to events. Ventilation and validation are necessary to give the individual an opportunity to emote.